I'm Dr. Pratik Das, working as a senior consultant nephrologist in Rabindranath Tagore International Institute of Cardiac Science, Kolkata, and working at the same time as a senior consultant running the transplantation unit of the same hospital. So here we are here to talk something about the kidney transplantation. Kidney transplantation means putting a kidney inside the body of a patient who is suffering from a kidney failure. Now, what is a kidney failure? Kidney failure means if kidney function goes below 15% of the normal functioning, kidney filtering function, then life cannot be sustained without the support from outside. This support may come either from the artificial machine, we call it a dialysis, that performs the function of the kidney, or it can come from a separate, newly normally functioning kidney that can be put inside the body of a patient suffering from the kidney failure. We call it renal replacement treatment. Both of them together, we call it a renal replacement therapy. As kidney is a vital organ, you cannot live without the kidney, like brain, heart, and the liver. So when kidney fails, you have to put something additional to sustain the life. So kidney transplantation is the best way to sustain life of patients who is suffering from a complete kidney failure, which is that means the kidney is lost permanently. This usually happens due to long-standing diabetes, long-standing hypertension, different glomerulonephritis or stone, kidney disease, infections like that. So kidney transplantation, although this sounds very horrible, but is the best way of treating a patient of kidney failure. By that, they can get a long life, a healthy life, and a better quality of life with a normally functioning kidneys. But the process is slightly complex. For that, you need to have a donor. As you know, the transplantations of the human organs is considered to be one of the miracle of the last century. This is going against the nature's practice. Here you put somebody's organ which is compatible with someone who needs it, so that this patient can survive. This can be done by the help of the two persons, one who will donate and person who will accept. We call it a kidney donor and a kidney recipient. So in the kidney donor, who can be the kidney donor? There are two ways when the kidney can come. One is from a patient who is suffering, who has suffered from some irreversible damage to the brain and is brain dead and dying in an ICU of a hospital on the ventilator. We call them is a brain death, but after some test, if it is declared that there is irreversible damage and patient cannot survive. In those situations, if the other organs are healthy and functioning, like kidney, heart, and liver, they can be taken care of with the permission of the hospital and state authority or the government authority, and they can be put on the body of such persons who are needing it, maybe a heart, maybe a kidney, maybe a liver. So by that, one person who is suffering from brain death and family wishes to donate two kidneys, they can save the life of the two patients, because one kidney placement is enough for the survival. Here the one kidney is placed in one person, another is another person. So this is one way of getting kidney. This is practiced worldwide, but in our country like India, this practice is slightly in the developing phase. Some areas is practiced widely, some areas it is slightly less. But this is one of the important way of getting kidneys. For that, more and more awareness is required for the declaration of the brain dead among the medical and paramedical fraternities. At the same time, there is more willingness about in the common people, so that they can donate their organ after the stage of brain death. And that can be placed before death also. Somebody can place by putting a form in a specific website of the national system, and so that if family members agrees after his brain death, in those situations, if the heart is beating, in those situations the organ is taken. So this is one way of getting kidney. Another way of getting kidney is from either someone keen, near and dear one, relations, parents, sons, brothers, sister. If they can, they will to donate the kidneys, matches like blood group match, some tissue matching or the HLA system matching. And after that, if everything is matched, in those situations, we can do the transplantation. So here is the process. The patient should be slightly prepared. Patient should suffer from renal failure and it should be a stable cardiac condition, lung condition. Transplantation has because you are putting an organ from outside, so they are very prone to infection and body may not accept. These two are the additional problems. If the body doesn't accept, we call it a rejection. And if due to prevention of the rejection, there are several drugs that are given which suppresses the immunity of the patients, which increases the proneness to infection. So these two, taking care of these two and balancing between these two is very important, because after transplantation, there we can divide the timeline in the three phases. In the immediate post-transplant period, after 7-10 days, when the patient stays within the hospital, in those situations, chances of rejection is there and chances of infection is also there. Surgical risk is there, bleeding risk is there. So that is completely taken care of by the your medical treatment team, which are taking care of the patient. But after the discharge, now patient responsibility begins from here. Here in the initial first 3-4 months, they need a strict isolation to avoid the infections. The diet should be slightly restricted. Water intake should be proper. Medicine taking time should be normally perfect. In those situations, the patient should take care of himself, but it is a huge responsibility. So for the patient is concerned and the family members, in those areas, if something happens like infection, like fever, or the patient is rise in the creatinine value, that is the most important detected parameters of the kidney dysfunction, they should consult with the doctor, and that can be treated some way. Among many of the patients recover from the treatment. If this initial 3 months period goes uneventfully, then you can gradually come back to your normal life in terms of your diet, in terms of your fluid intake, in terms of the official activities, and the physical activity, sexual life, that can come one by one. And at the end of 6 months to 1 year, patient can go back to the 95% original life. But there's some restriction like taking drugs on times and dietary, some restrictions and some avoidance, some precautionary measures to avoid infection, that goes on. But at the end of the day, if you perform the kidney transplantation, it is a much better life compared to your dialysis, because it gives you a normal life, a free life. And everybody should, when somebody is in the stage of kidney failure or in the going in the phase of the kidney failure, he or she or in the family should decide more and more to go in favor of a kidney transplantation, and that can give us a healthy, longer, and a better life. So, kidney transplantation is the best way of living of such patients, and it should be done in all nations wherever it is possible. It should be also prescribed by medical fraternities and the nephrologists, urologists, transplant physicians, surgeons, coordinators. Everybody should encourage the kidney transplantation so that we can increase the life of such patients. At the same time, it also increases the socio-economic burden of the country, because this is dialysis facility, they are not available always, and they have a huge economic burden to the society. So that also can be avoided. So it is the need of our country to perform kidney transplantation of the patients suffering from the kidney diseases. Thank you.